Hello, my name is Avery Fowler, and my presentation is about hypertension, commonly known as high blood pressure, and two medications frequently prescribed to manage it, lisinopril and amlodipine. So let's get started. Hypertension is a condition where the force of blood against the artery walls is consistently too high. It's often referred to as the silent killer because most people don't experience symptoms until complications develop. However, in severe cases, symptoms like headaches, dizziness, nosebleeds, and shortness of breath may appear. If left untreated, hypertension can lead to serious health issues like heart disease, stroke, and kidney problems. The first medication I'll discuss is lisinopril. Its brand names include Prinavil and Zestril. It's classified as an ACE inhibitor, which stands for angiotensin converting enzyme inhibitor. It's manufactured by Merck & Co. Lisinopril works by blocking an enzyme that converts angiotensin 1 into angiotensin 2, a hormone that causes blood vessels to constrict. By preventing this process, it relaxes blood vessels and lowers blood pressure. This helps reduce the risk of complications like stroke and heart attack, making it a popular choice for managing high blood pressure. Lisinopril is taken orally, usually as a tablet once a day. It can be taken with or without food, and the typical starting dose is 10 milligrams, which may be adjusted based on the patient's needs. Like any medication, lisinopril has potential side effects. Common ones include a persistent dry cough, dizziness, and elevated potassium levels. In rare cases, it can cause an angioedema, which is swelling under the skin or severe low blood pressure. It's important to note that lisinopril can interact with other drugs. For instance, combining it with potassium supplements or potassium-sparing diuretics can lead to dangerously high potassium levels. Additionally, NSAIDs like ibuprofen may reduce its effectiveness. While there are no major food interactions, patients should avoid salt substitutes that contain potassium. Now let's move on to amlodipine. It's sold under the brand name Norvasc and is classified as a calcium channel blocker. It's manufactured by Pfizer and is another commonly prescribed medication for hypertension. Amlodipine works by blocking calcium from entering the muscle cells in the heart and blood vessels. This action relaxes the blood vessels and improves blood flow, which lowers blood pressure and reduces the strain on the heart. It's also used to treat chest pain or angina. Amlodipine is also taken orally, typically as a once-daily tablet. The starting dose is often 5 milligrams and can be increased to 10 milligrams depending on the patient's response to treatment. Common side effects of amlodipine include swelling in the ankles or feet, dizziness, and flushing. Rare but serious side effects include an irregular heartbeat or worsening symptoms of heart failure. Amlodipine can interact with other blood pressure medications, potentially causing an excessive drop in blood pressure. Additionally, grapefruit can increase the concentration of amlodipine in the body, which can lead to side effects. Patients are often advised to avoid grapefruit or grapefruit juice while taking this medication. When it comes to exercise, lisinopril and amlodipine generally allow patients to maintain an active lifestyle. However, people taking these medications should be cautious during intense physical activity as they may experience dizziness or a drop in blood pressure. Swelling from amlodipine can also affect comfort during exercise. In summary, hypertension is a common but serious condition that requires careful management. Lisinopril and amlodipine are two widely used medications, each with unique mechanisms to lower blood pressure and reduce the risk of complications. While effective, both drugs have potential side effects and interactions that require monitoring. This concludes my presentation. Here are the references I used to compile this information. Thank you for your attention.